you spent decades developing Palmar cooling technology and have determined what works best in transferring heat from the body. You've also learned many features through the years that limit effectiveness. Can you talk to us a bit about why you want to use the hands and why the rest of the body is not as effective?
Sure, it seems counterintuitive that the hands would be the site of heat extraction because their surface area is relatively small in comparison to the surface area of the torso of the body, for example. Well, the reason that the hands are the source or the site for heat extraction, for effective heat extraction, is that the overall body surface is the sensor for the thermostat. The thermostat is in the brain. And when we go into a cold environment, the set point for that heat extraction changes. When we go into a hot environment, it changes. Okay. So an analogy I like to use is that if your car is overheating and you have a garden hose, would you spray the tubes to the radiator or would you spray the radiator itself? Okay. So
Right.
so your maximum heat extraction is from the radiator, and these surfaces are radiators. That's essentially what they are. Blood carries heat to these surfaces. They go up in temperature, and they are therefore dumping more heat to the environment. Now, what happens when you cool the overall surface of the body? That's telling the thermostat, oh, you're fine, no problem. And these blood vessels close. So you can actually put yourself in a situation by cooling the surface of the body in which instead of increasing your heat loss, you're decreasing your heat loss. Now, of course,
That's great.
the counter to that is what about ice bath? And an ice bath certainly is effective because it's so overwhelming. It's covering such a huge portion of your body, but we don't frequently have ice baths available. They're not that convenient to use. So what you want to do is you want to maximize the heat extraction from these surfaces which have evolved to be heat exchangers.
So I like that radiator analogy. So basically, if I understand it correctly, what's happening is when I'm overheated, if I can leverage my hands, it's pulling heat and dumping heat out to the atmosphere, or in our example, the CoolMed technology, allowing colder blood to flow to your heart. And like the radiator analogy, cooling you from the inside out.
Yeah, actually, probably the better analogy is putting a washcloth over the thermostat. That's
So
maybe
the washcloth over the thermostat, just like you're tricking your brain, your thermostat,
right,
and impacting the air conditioner.
right. A question is frequently asked why the limited surface area of the hands is the place to extract heat from the body rather than the overall body surface, which is much greater. And the answer is the overall body surface is the sensor for our thermoregulatory system, and the hands are the effectors. So, in comparison with your home system, heating and cooling system, you have a thermostat, and that thermostat is sensitive to information coming in, and that information is the temperature of the room. Well, for our thermostats, which are in our brain, that information comes from the overall temperature of the skin of the body. That's the sensor. And then what the thermostat does is it turns on the air conditioner or the mechanism for extraction of heat. So if you want to cool down your room at home, would you put a wet washcloth over the thermostat? No. So that's essentially what you're doing when you cool the torso of the body. You're sending in a signal to the thermostat that says, everything's okay. You're not hot. And therefore, the thermostat shuts off the heat flow that's coming from the palms of the hands, soles of the feet, and the face.
Got it. So the brain thermostat is not clicking on to activate the hands in your example.
Right. It's turning off.
Perfect. That's great. Thank you very much, Dr. Heller.